Don't be nervous. All right, Veronica. Again, it's so nice to see you again. All right, so listen. Last time you were here was how long ago? But I'm going to go back to the beginning in a second.
About a year ago.
Okay, a year ago.
A little less than a year.
So let's go right back to the beginning. Okay, you came in here, and what was going on in your life?
I couldn't sleep. I had constant heartburn. I was eating, and I say eating Tums because I would buy the big giant one, and it would last me a week and a half. I couldn't go to the bathroom regularly. I was like nervous, I'm still kind of nervous, but bad.
Okay.
Like anxiety?
Yeah, just everything. It was so horrible. And I would go to bed at 11, and I wouldn't go to sleep until 2, and then I would get up twice in the night, and then have to be up at 6 to go to work. So I hadn't slept in years.
Okay.
Like I had an infant in the house or something.
And then ultimately, I don't remember how our paths crossed. Anyway,
I found you online.
Okay.
I went to the doctor, and he was gonna up my medication.
Right.
And I was like, no more medication. I'm done with this medication nonsense because it hasn't worked. They started me off on 0.50, and then I was up to.
So this was medication for what?
Thyroid.
Right.
For it was Synthroid.
Yeah.
And it just didn't help. I kept gaining weight. I kept being sick.
Right.
And
how long were you on the medication?
About 2 years,
2 years.
before I got here.
Mm-hmm.
And I thought that was going to be the savings grace, and it just was horrible. It just got worse and worse and worse and worse.
So, all right, so we did some blood chemistry and we found out that you were what?
I had Hashimoto's.
Right, autoimmune thyroid.
And you took a lot of blood.
Listen, don't blame me. I have nothing to do with that. That's
I was
the
like,
lab.
how many vials? And then I came and I was very impatient because, I talked to you and I talked to you on the phone and I was ready to go. I was like, come on, let's do this. Let's fix me. And you were like, calm down. We got to get the results.
Marathon,
we got to
not
make
a sprint,
sure
right?
everything. We have to make sure everything. So I actually ended up going on vacation, which was really good. And when I came back, you talked to me and you said, okay, this is what's wrong. And you told me everything that was wrong. And you also told me that if I kept on that path I was going, it was inevitable I was going to have a stroke or a heart attack.
Right.
Like
so your blood chemistry markers were a lot of inflammation.
Right.
Right.
What was your weight at that time?
Yeah.
365 pounds.
What is your weight a year later?
A year from that?
Well, now.
Today.
230 pounds.
Okay.
As of this morning.
So 150 almost?
Yeah, just about.
Amazing.
I figured by the end of the day.
Yeah.
Yeah.
Right.
And
I've had 2 stalls.
Yeah.
And one was stress that we talked about. And then this last one, which was my fat. I wasn't eating enough fat, which was hysterical. I was like,
right. We talked about that.
Exactly. So it's not like we put you really on a diet program at all. We just tried to get you healthier.
Yeah. I tell people I'm not on Weight Watchers or Jenny Craig. It's not a diet. It's a change of life.
Lifestyle. It's a health restoration
my
program.
entire life.
Right.
And it is awesome.
Awesome. Now a lot of
my skin is clearer.
Right.
My skin is clearer. I like that.
Yeah, you look at least 10 years younger.
At least. Now a lot of people say, you know what, obviously you made some changes in your life. Was it worth it?
Absolutely. I'm the only thing I'm upset about is that I did not get to meet you guys sooner.
Well, you know what?
That's the only thing that upsets me.
Well, most of our Hashimoto patients come to us not after 2 years, but more like after 10 years.
Right.
So you're kind of fortunate that you discovered the flaws of that other model early.
Right.
Because most people do suffer for longer. And then it's harder, we can still do it, but it's harder to reverse 10 years of the body attacking itself, which is what was happening.
And he said, if you don't take it seriously, it's not going to work. That was it. Yeah. And I was like, then that's it.
Yeah.
Right.
And you showed me, I'll never forget it, the list of ingredients, this whole big list of ingredients, and you turned it over, and it was Slim Fast.
Oh, yeah.
And I was like, I was on that. That was in my body.
That's crazy.
So and then I started to read, and I started to, I got on your nerves a little with that. I was like, is this okay? Should I be doing this?
No, listen,
You know?
that's all part of the process. I mean, this is a process of self-discovery. Listen, again, our
Totally.
goal is to be able to empower you, not have you depend on us.
Yeah.
Teach you so you can
Right.
do this for yourself, not just take the advice of a quote-unquote expert.
Right.
Right? Follow this and don't question what I say.
Right.
But no other expert endocrinologist had given you that diagnosis.
Nothing. No one. Not at all. Even now, like I made an appointment and I told the doctor what you said, and I said, I have my blood results. We don't have to take any more blood, please. I
Yeah.
have my blood results. They're recent. Oh, well, I was like, I don't know. I might have to talk to somebody else because now I don't know. Like,
Well, do you have a primary that hasn't seen you in a while?
yeah, I'm going to go to my primary and see if I can see someone else or something because I'm not happy with that.
But what have they said about all that loss of weight?
Oh, God. Like, she's amazing. She's,
Yeah.
Dr. Patel, she's, what? How? What?
Yeah.
What? And I was like, and I got a little miffed and I let her know. And I was like, yeah, you didn't do this. You didn't do this.
Again, so listen, it's not that they're trying to be bad, it's just that
Of course
the model
not. But
is
my whole thing is you're
completely
practicing medicine, get to practicing. You kind of slacked off because this is you should know this. I shouldn't have had to drive all the way up there to find this out.
Well, it's not their fault. They're not trained this way.
Yeah.
I mean, it's very few
Yeah.
very few doctors, very few people in our profession, very few people understand integrative functional medicine.
Right.
It's not conventional wisdom, so it's not their fault. But you would think that a healthcare provider would be,
Or at least
yeah.
be able to point you in that direction.
Right.
Like okay, maybe I don't know about it, but I do know it exists. Try that. I got nothing.
Yeah.
I had to be my own advocate because if I wasn't, I'd be dead right now.
Yeah.
Right, and unfortunately, that's the way most people in healthcare are. I mean, they have to do things on their own to discover what's the matter with them. Right.
It's
Right.
pretty exciting.
Yeah.
And
So what's your goal now? I mean, you've come far.
yes.
Okay, where are you now in terms of your goal? I know we
Now,
talked about
okay,
this a
I
little
feel
bit.
healthier. I am healthier. Like, yay. Now, it's a little vain. I want 50 more pounds off because I want to look cute.
Jesus.
Yeah.
Now comes into the vanity.
When was the last time you were this weight?
Right before I had my daughter, I was less than this.
Yeah.
Right before I had my daughter,
Right.
and then it just kind of.
Of course, because your autoimmunity probably turned on by having your
Pregnancy.
daughter, and then that's it. Listen, you have more questions? I mean, listen, you are the poster child of what is possible when you.
Can we put her on the? I love it.
We're gonna get a picture of her right now. Yeah, we're gonna put you out there. Yes. So listen, Veronica, it's awesome seeing you. I know
It's
we're a little
so
bit of
good to see
yeah.
you guys. It's
you
so
do-
good to. It's so good. Everything is so freaking good. Like, and you know what? A friend of mine, a really, really good friend, we were pregnant at the same time. And she gained a lot. And so I was trying to talk to her about it, and she didn't get it. So what did she do? She had weight loss surgery.
Right.
She got cut.
Yeah.
So on Thanksgiving, while I'm sitting there eating, I am eating.
She's
She
what
had
in the bathroom throwing up?
She had a
because- right.
thimble full of food,
Right.
and I was like,
When
"Oh
was
no,
her-
honey,
when was
I
her-
ate."
When was her surgery?
I think so. It had to be in August,
Yeah.
and then
Well, we'll have to see where she is a few years down the road, because that's the real proof of the pudding. Not right away, because usually in the beginning, your stomach's small.
no.
you lose
But the
weight,
thing is, like this, is that she can't eat.
Right.
Like, that's not good. That's not healthy, and that's not fun. Like, you can't. You can't take away my food. Like, I have to eat.
It's the easy way out.
Yeah.
Instead of saying, "Listen, I got to be," I have to make some changes in my life to support
Well,
health.
and then when I ask her, "Oh, well, what did you eat today?" She's like, "Well, I went to the Chinese restaurant," and I was like,
Oh God.
There goes your palpitations.
"Yeah," and I was like, "Oh,"
Don't
and
do
I was
that.
Yeah, like, I was like, "What do you do?" So you're not eating any better. You're just eating less crap. Not
Correct.
cutting out the crap. You're just eating less crap,
Correct.
and that's just not
Less toxins.
right. Yeah, it'll take a while to catch up with you now. Like, that's crazy.
Right.
And my trainer's very happy with you.
Oh, good. Yeah.
I'm glad.
Yeah.
I don't want to have to face
That's what
him.
I said.
right?
I can't have two men in my life fighting. I'm a lesbian. Like, that should not be happening. Like, oh my God. Because he was like, well, what do you, I don't want you losing weight this fast and blah, blah, blah. I was like, well, You know, and then after the first 50 pounds, he was like, "You need to listen to what he's saying."
Yeah.
And I was like, "Yeah, I thought so." And now he's like, "Well, what did he say? No, higher fat? Okay, yeah, let's try that." I was like,
So now
yeah.
he's actually agreeing with me, right?
Yeah,
Good,
exactly.
good. I'm glad to hear that.
And he, you know, and he said, what did he call me? Chronic cardio.
That was me. That was like.
Oh, okay.
Yeah.
And then he agreed with that, and I was like, "But I like coming to the gym."
Yeah.
Well, go there and socialize.
Well, how
Yeah.
often do you go
Right?
now?
Now I'm down to 4 days.
Yeah, we
Down to 4 days?
Yeah, she
Yeah.
was.
I'm
she
trying
was,
to work
out
my
of
way up
control.
to 4 days.
Right.
I was doing
Wow.
6 to 7 days a
Yeah,
week.
she was a little.
Yeah.
We had to tone it down a little bit.
Yeah, yeah,
Right.
and I do feel better.
Right.
It's like I do feel better in 2 days. Not yeah, I'm gonna no like. I was like, oh, this is what it feels like.
To
Okay.
recover.
Yeah.
Exactly.
Yeah,
So
that's what,
Yeah.
that's what it is.
Yeah, so it's pretty. God bless you both, really.
Ah,
It's just
Oh, it's very
incredible.
nice to hear.
Yeah.
And my daughter is so happy.
Well,
Yeah.
I'm glad.
How old is she?
She's 25.
We took a look at her. She needs to.
Yeah, she does.
Listen, I mean, you're an inspiration. If you're not leading by example, then
But
Well,
I don't know
still,
who
but
is.
still, she could be there, and her friend says, "I'll take the knife." People are
Exactly.
funny.
Yeah.
People are funny.
Yeah, that's true. That is true. I mean, one girlfriend I had got diagnosed with Hashimoto's, and I told her, well, look, you know, I have a doctor, blah, 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 this, that, and the other. She said, oh, yeah, I can't do all that.
Amazing.
And
It's
I was
just,
like,
it's just
Really is.
amazing.
You know how many times I hear, listen, I'd rather just take my pill. You know, I've got to, you know, we
But it
teach
doesn't
seminars.
work. It's
I agree with
this
that.
This is the thing. It's not that the pill, look, it just doesn't work. The
Of
pill
course.
just doesn't work.
If it
It's
worked the
not-
same way, I would take the pill too.
Everybody
It's
take
not
it.
a question of one's easier than the other. It's
just
one,
doesn't
one
work.
restores health,
Right.
one restores function,
Yeah.
one fixes your immune problem, and one is a scalpel.
Yeah.
They
And-
both
and-
have
and-
you lose weight, but one won't.
And now, like, I gets late and I lay down and I go to sleep.
What a concept.
Yeah. What a concept.
It's so wonderful
Yeah.
to be like, oh, I'm tired. Close my Kindle, and go to sleep.
Because before you used to just.
I was like, oh, I'm tired, and I would be tired in bed,
Right.
and just laying there, tired, and listen to her snore. That was
And
fun.
then most people would just take a drug
Oh yeah, sometimes I did take Tylenol PM and
to
then wake
knock
up
themselves out.
and be like, I'm gonna come in late, like,
Right.
because
Even
then
though
I
you
was
slept 8 hours, you're
groggy,
exhausted.
Right.
and it was just this horrible black hole of no sleep and stomach problems and headaches and
We can
that
have a
pain
whole
in my foot
we have a
that
whole
went
practice
away.
just on sleep.
Sure.
Build a whole
Yeah.
practice just on sleep.
No doubt.
And
Sleep
stress,
apnea,
sleep
yeah.
and stress.
Well, yeah, you're right. They're connected.
Because and just you just changed my life around. I don't know if you believe that. I don't know.
Listen,
Yeah,
we
we
believe
believe
it.
it.
When
We
you
believe
stand
it.
in front of us and you're half of what you were when you first came to see us. What's not to believe, right?
No, it's nice.
Now
to,
I would like you guys to chip in for new clothes though. That would
Wow.
really help out.
We gotta draw the line somewhere, okay?
Because
Right.
that was kind of well, look, like I still
It's true.
the body image thing is still not cool because I went to get new pants and I brought them home. Like, oh, wear these my new pants and they're still too big, so I still have to.
you can't get clothes too prematurely.
I know.
Because
Because
Right.
you
keep
know,
losing.
Yeah.
people buy new clothes, all of a sudden the new ones are too big.
Right, it's
Right.
pretty amazing. You must feel. Do your feet even touch the ground? Like
No, we're not that good.
because
Well,
you're
so
you are honestly, insanely, wonderfully changing people's lives.
That is true.
but we also have amazing patients who are. Listen,
That's the second part.
Exactly.
We can't. It's the patient does most of the work. They really do.
we're just the guide. Remember, you lead the horse to water.
Right.
Listen, your friend, she didn't
Yeah.
drink the water. She went and got it,
Yeah.
and there'll be long term.
She drank the Kool-Aid.
Exactly.
Yeah.
Not
Man,
The easy way out.
Not
Right,
the-
exactly.
it's just a wonderful thing, and thank you.
No, you're
for
very
changing
welcome.
my
Very
Very
life.
welcome.
And my daughter got engaged,
Oh, congratulations.
Oh, so what?
So
You're gonna be a
now-
skinny mom at the wedding?
Yes.
Yeah.
and I get to see my ex-husband.
There you go.
When's the wedding? Is it planned?
She's doing it next year in October.
Okay,
So,
awesome.
but right now they're in the process of buying a house, so they're living with me.
Next time. You can lose
And
50
there's
pounds
the
by
strength.
October.
Oh, hell
maybe.
yeah.
Yeah, we're gonna keep working.
Oh yeah, I
We're
can
gonna
do
do
that. I'm not even scared of that.
Right.
I know.
That's not even an issue.
Yeah.
Yeah.
I never thought I'd be sitting like this. I never thought I never ever.
Listen, when you first came to see me, that chair you're in with the arms, you weren't fitting in that chair.
No.
Not even close. I have to get you a stool or
Yeah.
something like that.
Yeah.
Right?
Should be part of the 200-pound club.
Yeah.
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 It's crazy.
Well, Veronica, listen, awesome. We're gonna keep working here, but you're a superstar.
Thank you.
You're very welcome.
Rockstar.
Thank you.